Okay, people are coming in. Welcome, welcome. Welcome to CrimCon for those of you coming in. It is 3 p.m. Eastern, so we are going to go ahead and get started. My name is Dr. Brianna Beaupre. I'm an assistant professor at Wichita State in Kansas, and I'm also a board member of CrimCon. So we are super excited to be hosting CrimCon. This is our first virtual conference, and we're super excited to have you here. We've had over 300 presentation submissions, and they've been fantastic. This is our last day, and I've seen many of them. They've been awesome. So thank you all for participating and making this a success. So I'll just go over what to expect for the panel. We'll proceed in the order of the conference program. Each presenter will have 10 minutes. And when you have a question, please ask it in the Q&A box, and then the panelists will answer them at the end. I will read them out loud, and then the panelists will answer each one. And so this is what it should look like on your end if you're an attendee. So here's your Q&A box at the bottom. And just remember to have fun. So CrimCon was meant to be something different, something more interactive and accessible. So we're really happy to have you here. And without further ado, I am going to pass it over to our first panelist, Alex. And this panel is on community policing.
There we go. Okay, so I'm Alex Billmeier, and I'm a first-year PhD student at Florida State University. This was a project completed for my master's. This was my area paper completed for that. So, my big things I really wanted to look at just the kind of disparate research that we have currently on community policing and the results that we're getting from that. So, a bit of context. Community policing was kind of developed out of this need to address longstanding community tensions and racial tensions around the 1960s. And it was partially a response to issues that kind of plagued the prior era of police work with the era of professionalism. And people were beginning to feel like there was a disconnect between police and the residents that they were policing. So, when this developed, and of course, with anything in its early stages of research, there were confusions about the long-term goals and what we were really shooting for with community policing, what we were really aiming for there. So, researchers were kind of unsure initially about whether we wanted to prevent crime with community policing or just to kind of work on those tensions. And it eventually turned into more of a crime control strategy with, easing tensions as kind of a good byproduct, but that was one of the main goals there. So, the organizing premise is built on creating those relationships with the community, and that eventually ends up reducing crime and improving quality of life. And the mechanisms that we, do that through are things like co-production of safety and kind of building that trust so community members are willing to work with police more often on fighting crime and preventing it. And, also we want to empower residents through community policing to develop this form of informal social control. So the main problem I looked at, and this really was just a pretty large review of the current state of the literature, and the main problems that I looked at was really just without a consistent theoretical framework to work with. It's difficult to really truly evaluate what we consider to be community policing. So the current empirical examinations that we have often examine programs that invoke a handful of tactics that can fall under the umbrella of community policing, and they do. But this collection of pretty disparate tactics is usually referred to solely as community policing. So when we get these results, we're saying community policing does work, community policing doesn't work. And therein kind of lies the problem. Scholars were really, studied these fully realized and consistently implemented community policing programs, which is difficult. There could be more conclusive results, but we just have to work towards something like that. So to examine the current state of the research, I kind of looked at it through this framework that was created by Gary Cordner in the 90s, and he's since kind of gone back and revised these ideas. But he laid out 4 dimensions, and within these 4 dimensions, there are certain aspects of community policing that these programs can contain. So, one of the big issues that I saw was that researchers often can emphasize one aspect within these dimensions, or maybe just a couple, and they're just kind of piecemeal, and they call it community policing, and at the same time, it's on the same end as practitioners doing the same thing, in police agencies implementing community policing. But there are 2 programs that we look at and we say these are, truly, these are effective community policing programs. They're both called community policing, and that's just kind of what we slap this label on it, but they're completely different things. So in my paper, I broke down the dimensions, and I looked at the state of the research through this framework. So even the dimensions that are discussed, they're not always consistent with the aspects that we include. Some of the aspects are implemented differently. So if we look at certain studies that we do, and we're looking at community policing, and we're saying it's a very different thing for police agencies to implement a community policing program, and they call it community policing, and then what it is developing citizen advisory board. So that allows for true citizen input and citizens actually having some kind of review process over police, versus police showing up to community meetings and maybe another department says that that's their community policing program. So we're studying things that have entirely different functions and mechanisms through which citizens can give true input, but we're still labeling it the same thing. So, my suggestions really are, we should be working towards a framework of community policing. And, when we're researching, we need to be clear about the aspects of community policing that are being studied, because they really all can play a part. And I do think this has improved over the years, and we have, even in the last 10 or so years, I've seen papers that actually use Cordner's framework to kind of identify the aspects of community policing that they're studying. There are different kind of more minor things we can do as researchers. We can even make pushes to expand certain data sources that we use, like the LEMAS data, the Law Enforcement Management Administrative Statistics Survey. And this collects data from thousands of law enforcement agencies across the country. And they have a pretty substantial part of it that collects data on community policing. So, using these uniform methods could really kind of improve the way that we look at it. And could be really more routinely used when we evaluate community policing programs, and just give us some kind of consistency with it. And there's a possibility maybe that could be expanded a little bit. There's also, research translation tools that are out there that could be further developed. An example is the Center for Evidence-Based Crime Policies, evidence-based policing matrix, and tools like this that can really kind of help the police departments in implementing strategies that work. It's just being clear as researchers about what works and what we want to see expanded and pushed for. So this is something, that we do need to really work together with practitioners as well, and be clear about the goals and strategies, because it's not only the researchers that are, it's very much not researchers that are saying, okay, well, we're studying this and we're calling it the same thing. We see the same thing with departments, and they're just implementing things differently, and they're calling it they're saying that it's the same thing too. So they implement community policing, and we have to kind of look at it like that because we don't have as much to go off of. So there's just so much inconsistency in the research and in the programs that we have, that I think that we need to be really kind of moving towards, more consistency, and moving towards some kind of framework that we can address. So, that's all I have for you, and I appreciate you all listening. Thank you.
Great, thank you. So now we will move on to our next panelist.
Okay, I'm pulling up now. Okay, can you see my slides?
Not yet.
No, not yet.
How about now? Oh, wait. Sorry, I always hit it and then forget to hit the share. Step 2.
You're good.
Okay. Now do you see it?
No. Wait,
Or
well,
not?
I see, like your open PowerPoint. It looks like you just shifted it to another screen though. Okay,
Oh,
now I can see it.
There it goes. Yeah.
we're
Perfect.
good. Okay. All right. Well, thank you everyone for being here. Kind of hitting this final stretch of the conference, so we appreciate you being here. I am here with my colleague, Ashley Blackburn. I'm going to be presenting on evaluation of the core telehealth program to manage mental health emergency crisis calls. So this program, known as the Clinician and Officer Remote Evaluation Project, or the CORE project, took place in Houston, Texas, and it involves a partnership between the Harris County Sheriff's Department and the Harris Center of Mental Health and IDD. So the Harris Center is basically the mental health authority, as they call it in Texas, or the community mental health program there. And so the goal of this project was to use technology to increase both jail and hospital emergency room diversions in cases where 911 calls come in for a mental health or a behavioral health crisis. So I'm just going to talk a little bit about the background of this project, given we came in at a little bit of a later stage to do the evaluation. It actually started in December of 2017, where a psychiatrist, Dr. Fishkin, approached the Harris County Sheriff's Office and expressed this kind of desire to take telepsychiatry to the community, and voiced that he really thought it was a good place for officers to be able to connect with mental health professionals to help manage mental health crisis calls. And so they did a very small 3-week pilot that really looked at how well this kind of system might work. It was a successful pilot, but once the short pilot was over, the issue of contracts and cost came up. And what they found is it really became cost prohibitive to continue. And so what the Harris County Sheriff's Office did is, really liking the model, went to the local mental health authority, the Harris Center, to see if they might partner in the project. And one of the big changes here were that they moved from psychiatrist on the other end of the telehealth or the iPad calls to instead master level mental health clinicians. So phase 2 was again, kind of a short, a smaller pilot of that. And then that went into phase 3, where in phase 2, they used deputies that were pretty integrally involved in the project. By phase 3, they expanded it to 20 patrol deputies that were more like real deputies in the community to really see how this project would work. And that's when we became involved for the evaluation and conducted an evaluation really just of the implementation and how stakeholders saw the project and how implementation went. So to that effect, we did a mixed methods approach to evaluate the implementation of this phase 3 of this project. What I'm going to be presenting on today is just the quantitative data sample, and where this data came is from a deputy activity form. So essentially, anytime a deputy elected to use the iPads to connect with a mental health practitioner, they would complete an activity form that coded kind of what they did and what that call consisted of, as well as kind of their perceptions on the usefulness of that call. So we have a total of 361 calls where we have these data, and I'm just going to be presenting some univariate descriptive data. So I'll talk first about the mental health outcomes. So one, I guess, piece of information just about the consumers in the community for whom these calls were used. At the time of the call, the deputies asked, how many of you are you on medication, and have you been taking your medication? And for those consumers whom they asked, about 76% responded that they were not medication compliant at the time of that call. And an additional 54% said that they were not connected to that community mental health authority at the time of the call. So they may have been connected to a private psychiatrist or private insurance mental health practitioner, but only half were connected to the actual community mental health provider at that time. So we can see here that these were consumers that may not have been involved in services to a large degree. Now, from the deputies' perception, 88% of deputies reported that they would have called a CIRT team had they not had access to the iPad. So the CIRT is the Crisis Intervention Response Team, and those are teams that you see across the country that really partner law enforcement with mental health, except that mental health clinicians ride along with law enforcement and handle cases right on scene. So what they said is access to the iPad allotted them to use that device instead of calling in a CERT team. 78% also reported that they would have transported the consumer to an ER or mental health facility had they not had access to the iPad. So, and this kind of goes to the next one, 89% stated that the clinicians helped to identify resources. So they were both able to kind of divert the cases that they would have otherwise transported, and also connect those consumers who didn't have access to certain resources in the community with those resources. One of the other things we coded was the nature of the call. So this came from the actual call takers, the dispatch. And what they did is they coded the type of call that was coming in. And as you see here, family disturbance, and this is where I am, family disturbance is the highest frequent type of call. So that came in at 24%. But the numbers at that, or the codes that I have circled, are all codes that really represent types of calls that are not criminal complaints, right? So these, you can see, and these are about 50% of the calls that, and you know, some above would fall under this as well, but a cluster of calls that really suggest that these weren't calls that would have necessarily ended in arrest, but certainly still consisted of potential mental health crises. So back to officer perception or deputy perception, 86% stated that the clinician helped to de-escalate the consumer. So they were given two options. They could consult directly with the clinician, which they always did, but they also had the option of handing the consumer the iPad so that the clinician could interface directly with the consumer. And that may have helped with de-escalation as well as, again, connecting to resources. 93% stated that the clinician helped to decide on the course of action to take. So that was an important indicator for us. Did that consult help you decide, you know, what should I do in this situation? And then finally, 88% stated that the clinician helped them to handle the call in a shorter period of time. So efficiency was also a big indicator that we were looking at as well. This next set of slides look at, or set of data look at call usage and disposition. So one of the big questions was, when CORE was used, when the iPad was used, what happened by the end of that call? So there's really just a couple of options. Either the deputy leaves and the call is resolved on scene, or there's some kind of hold placed or transport done. And so what you see is in 42% of the cases, deputies were able to manage the call on scene, respond, but leave the consumer, often again with clinicians connecting them to resources. And then in 58% of the cases, there was a transport, typically to some kind of mental health facility. You'll see I noted in just 2 cases were consumers transported to jail or detention. Now, I will say an important caveat is that deputies were not required to use CORE for each mental health call. So they were essentially given the option. If, for example, they responded to a scene where there was a clear criminal violation and they knew they were going to arrest, right, the person on scene, then they would have placed that person under arrest. Or if it was very clear that a person had attempted suicide and they needed to sign a hold and transport them, they would not have called necessarily the CORE clinician. They were specifically instructed to use the iPad in times where it was a gray area or they weren't clear on what the appropriate course of action, or really just wanted a mental health experts kind of input on what that might be. So that's, but we still see that many of the calls were able to be resolved on scene in that fashion. Again, speaking to efficiency, the average time on the call was 21 minutes. So they were able to efficiently handle these calls. During phase 1 or 2, they worked out a lot of the bugs in terms of just connections. You can see by phase 3, 98% of the time they were able to connect and didn't have internet issues. And one of the concerns was that maybe consumers wouldn't be comfortable with speaking to someone on an iPad, especially in the face of the fact that these are crisis situations those consumers are in. But you see only 4 consumers were reported as refusing to use the iPad. Okay, so in terms of study limitations, one of the things I noted is that this was really an evaluation of the implementation. We didn't have a treatment as usual comparison sample to really say, were we more frequently able to leave people on the scene or not? And so hopefully next phases will allow us to look at more outcome. Also, we were unable to access records from the mental health partner. And so here we don't have data on diagnoses, on follow-up with mental health clinicians. Our data comes from the law enforcement end. Although we do have qualitative data that we're able to collect there. Finally, for policy implications, this program has been deemed a force multiplier, meaning the technology is really used to be able to dispatch far more officers the ability to connect. Harris County has 4.3 million people. It covers 1,800 square feet, and there is one CERT team. So the need to be able to expand the reach for mental health calls is really important. And lastly, a core implementation guide was created that helped other jurisdictions to be able to replicate this. And that's all that I have. Here are the partners and contact. Thank you so much.
Awesome, thank you. So now we'll have our third panelist, please.
Okay.
Oh, Lori, can you stop sharing your screen? Thank you. Daniel?
Alrighty. Let me get the screen share going. Alrighty. So my presentation is, can everybody see the screen okay?
Yes, that looks perfect.
Awesome. So my presentation is some work that I did with a couple of colleagues, one at Ball State and one at Washington State. And it's a paper that we've actually published in the Journal of Criminal Justice. So, if you want more details, you can find it there. But Alex gave a good overview of community policing, so I can speed through a bunch of that stuff. The larger focus of our paper is on officer-involved homicides or officer-involved shootings. So particularly since the deaths of Eric Garner, Tamir Rice, and Michael Brown, we've seen a greater increase in civil unrest surrounding these events. And particularly after the death of Michael Brown, we saw the events unfold in Ferguson, and the Department of Justice came in and investigated that and found all kinds of bad policies. And as part of that, as an outgrowth, the Obama administration's presidential task force made 6 recommendations, one of which was community policing, a greater emphasis on community policing. And so we know it's amorphous and it's a little less clear, but does it work, right? Well, the evidence mostly is mixed. It can have an impact on disorder, crime, it's still kind of out. When you incorporate things like problem solving and foot patrol combined with problem solving in more recent analyses of foot patrol, it can have an impact on, violent behavior. So the thought then is taking all of that together when we combine that with police shootings, is it possible that if an agency is more committed to community policing and this investment in the community and partnership, they might be less likely to use deadly force against the community. Okay, so our hypothesis was that an agency's stronger commitment to community policing will have fewer officer-involved fatal encounters. So we cobbled together 4 different data sources for this project. First was the Fatal Encounters database. It's a crowdsourced police shootings database where, similar to the Washington Post or the Guardian, this is just another one of those. It's independent. It was created by a journalist. We went with this one because it goes a little bit further back than the Washington Post data does. We also used UCR data for crime statistics in the area, census data, and then finally LEMIS, the Law Enforcement Management and Administrative Statistics Survey, which is the way that we measured community policing. So the dependent variable for this was fatal encounters, which was just a count of the number of fatal encounters in the jurisdiction for the observational year. We used data from 2012, 2013, and 2014 because of that was the data in which made the most sense for the year of LEMIS that we collected. Or that we were able to use. Unfortunately, when we were doing this project, the more recent iteration of LEMIS, which is, I believe, 2016, was not available. So the independent variables for this particular project break down into community policing variables, police organization variables, and community. For community policing, we measured whether the agency used community policing as part of recruit training, whether they required in-service training, whether they participated in SARA projects or problem-solving projects, whether they worked collaboratively with the community, permanent beat assignments, whether problem-solving partnerships were codified, written agreements, not just informal things, and then community surveys, and finally, if they have a mission statement involving community policing. For police organizational variables, we had whether or not they had a SWAT team to get at that sort of aggressive policing aspect, the percentage of, or the proportion of full-time sworn officers, the number of special units, and then the proportion of officers assigned to permanent beats. For the community, we measured whether or not the location was in the South, median income, percent Black, percent Hispanic, unemployment, cash assistance, and then also percent Black squared. We did also see if percent Hispanic squared made a difference, and it didn't, so we omitted it from the study. We used, because it was a limited count, the vast majority of observations had 0 fatal encounters. So we used negative binomial regression, and we had a final sample size of 1,412. We did the analyses for the regression in 2 stages. The first stage was the full sample. We then noticed that there were 5 locations that had a tremendous number, more than 20 fatal shootings. And so we eliminated those and reran all the analyses, and I'll present both tables. So here you have the descriptive statistics. You can see that there are some things that are more common than others. For example, in-service training, it's about 50-50 versus virtually every department had a mission statement relating to the project. Fairly large police agencies, 265 being the mean. So a range of police departments involved in this analysis. So looking here at the full sample, what we see is evidence that is contrary to our hypothesis, because most notably, recruit training actually increased the number of shootings, along with being involved in problem-solving partnerships, which is definitely surprising given the evidence that you'd expect problem-solving to allow officers to find other ways to resolve situations. But also of note is that our agency characteristics really was the strong driving force. The larger the proportion of officers assigned to permanent beats in that department was significant, and also whether or not there was a SWAT team. Most of the community variables weren't significant, or if they were, the effect size was very, very small. When we reran the analyses without the outliers, pretty similar results. The problem-solving partnerships did drop out, but recruit training remained significant, and also permanent beats and and SWAT remains significant as well, or permanent beat proportion. So a couple of limitations for our study. We have no idea what the curriculum for this community policing training involves. You know, the agency is just saying that they do it. So it's really hard to tell what kind of information they're getting. We know that there's quite a bit of variation amongst community policing, because after all, the stop and frisk that was done in New York was done under the guise of community policing. So, and another limitation is just the aggregated nature of the data. It's hard to get down there on a more granular level. And then finally, participation in LEMIS is voluntary, so not every department participates. We did lose some data that was departments that were in the fatal encounters data set, but they didn't have the LEMIS information, so we weren't able to include them. So overall, what we found was that, you know, our hypothesis clearly was not supported because community policing generally wasn't influencing fatal encounters, and the couple of variables that did were in the non-predicted direction. And essentially what we see driving fatal encounters based on this data really is agency demographics, that SWAT team just kind of showing a general aggressive police department, and the permanent beat assignment. So again, just more sort of what I've already talked about. So just go through that. And that is what I have. So thank you very much for your time.
Great, thank you.
Should I start our presentation now?
Yep, you're good to go.
Okay. Okay, can everyone see that?
Yeah, it looks great.
Okay, great, awesome. My name is Lily, or I should probably turn my camera on maybe. There we go. My name is Lily Robin, and myself and my colleague Libby Doyle from the Urban Institute are going to talk about a 2019 assessment we conducted of the Los Angeles Community Safety Partnership. So just to give some background, the Community Safety Partnership, which I'll be calling CSP for brevity, it's a program in public housing developments in Los Angeles, and it's a partnership between the Housing Authority of the City of Los Angeles, so HACLA, and the Los Angeles Police Department, or LAPD. Its goals are to improve public safety and quality of life, increase community engagement and youth outcomes, foster police community relationships, and change LAPD policing mindsets and approaches in the developments. And they do that through activities that fall within 4 different buckets: community outreach, youth programming, critical enforcement, and safe passage, which, if you're not familiar, it's just a program that helps students get to and from school safely with the assistance of police officers. And on the bottom, the graphic here is a timeline. So there was a rollout of the program in 2011 and an assessment conducted by the Urban Institute in 2014. Since then, there were 2 more waves of implementation in 2015 and 2016, and then we conducted our assessment in 2019. So this is just a map of Los Angeles, and the dots are public housing developments. The blue dots are where there are there's CSP program, sorry, tongue-tied a bit. There's CSP programming in a development, and the yellow dots are where there is not. And then, so we used that as a way to do a panel difference and difference regression analysis. And then also you can see that these are not like geographically dispersed in a random way. So we also leveraged the fact that there were waves to conduct additional difference and difference analysis between amongst all of the sites that have the programming, but at different points in time where some did and some did not have programming. And using that method, we looked at LAPD crime, arrest, and calls for service data. And then additionally, we also looked at program data. So that included information like the funding and number of officers in each development with the program, and then also just information on the youth and adult programming that's run through CSP. So there's like yoga, soccer camps, things like that. So we looked at the number of programs in each development and like the enrollment. And we conducted interviews with LAPD sworn staff and HACLA managers and leadership. And we also conducted focus groups primarily in developments that had the program, but also in some that did not as a comparison point. So I'm going to really briefly go over our quantitative findings, just for brevity. I'm not going to go into them too much throughout the presentation. So we did, for crime trends, find an overall reduction in expected crimes. Looking at type, though, that was only statistically significant for property crimes. And for arrests, we also found an overall reduction in expected arrests, but we did not find that for arrests of juveniles. It actually went up, but that was not statistically significant. So in terms of our overall takeaways, looking at the implementation and impact of the program, we looked at model fidelity, crime and public safety, and resident quality of life. We're not going to talk about model fidelity for this presentation, but for crime trends and public safety, as you could see from the previous slide, we did see in CSP developments, there seemed to be experiencing fewer crimes and arrests because of their involvement in the program. Residents, officers, and managers all also reported lower crime overall, but they also reported persistent issues with gangs, loitering, theft, and parking enforcement. And we talk a little bit more about that in resident quality of life. There was also from HACLA managers a desire, and some officers, a desire for increased enforcement, particularly on nights and weekends. And then even though a lot of people across different things reported lower crime overall, residents didn't necessarily attribute that drop in crime to the program. And then just here's a quote from our interviews from a HACLA manager that said, there are certain intangible aspects of having a team of police who people know, who build trust and prevent the escalation of something small. I'm going to turn it over to Libby to talk about quality of life.
Okay, so we used calls for service data and information gathered from the residents, HACLA managers, and CSP officers from our qualitative data analysis to gather information on resident quality of life and how the CSP program did or did not affect this. So some of the main takeaways from our findings for this were, first, on the quantitative side, there did appear to be a decrease in calls for service compared to the expected number of calls in CSP sites. This may be linked to a drop in crime and or an increase in police presence and increased access to officers' direct lines through the CSP program. And then on the qualitative side, we found that officers and managers perceive increased trust in police from the community, but overall residents expressed a lack of trust in police and shared concerns about treatment as well as lack of anonymity when reporting crimes. Residents also had concerns that there may be officers acting contrary to the goals and the missions of the program. And then officers, managers, and residents also continually reported issues with gangs, loitering, parking, trash, all of which can affect quality of life, which Lily mentioned a little bit earlier. And then in addition, officers and managers expressed frustrations over limited enforcement capabilities of CSP. And officers really cited it as a reason for these ongoing issues in the communities. We also found that due to the CSP program, there is an abundance of youth programming that residents did generally cite enjoying and utilizing in the developments. And then on the next slide, we have a quote from a resident that just really illustrates the concern that some of the CSP site residents had that some officers may act contrary to the goals and mission of the CSP program, further damaging resident officer relationships. So here I'll just go through some of our recommendations. So at the end of our report, we provided 9 recommendations to improve the CSP program for stakeholders who were considering expanding to additional sites. So based off of both of our quantitative and our qualitative findings, we recommended that stakeholders, 1, increase collaboration and communication between HACLA and LAPD at all levels. 2, improve tracking of CSP activities, particularly services and participation. 3, jointly clarify the mission and goals and communicate that to all CSP stakeholders and in particular CSP officers. And then 4, increase LAPD's visible presence in the development. 5, develop a plan to address ongoing quality of life issues. So some of those issues like loitering and trash that we discussed earlier. And then 6, improve hiring and ongoing assessment of officers for fit with CSP to make sure that they really are fitting with the program's mission and goals. 7, improve the resources available for officers. So that's something that came up a lot in our interviews with officers, that they felt that they didn't have a dedicated space or enough resources to really fulfill the mission of the program. 8, do a deeper dive into the most and least successful developments to understand the driving factors for the differences between these developments, because we did see that it varied quite a bit across different developments. And then 9, improve community engagement between LAPD and HACLA residents. LAPD, HACLA managers, and the residents. So all 3 of those groups of stakeholders. So these recommendations are really geared towards the stakeholders who are looking to expand the program. However, given kind of the current conversations around law enforcement, we suggest that stakeholders who are hoping to address crime as well as community disengagement also consider funding alternatives to law enforcement-based interventions. So given the historical context of over-policing, decreased access to resources, and systemic racism in these specific neighborhoods in LA, we suggest that research on community-led programming and funding for social support services should also be considered when stakeholders think about starting or expanding programs like this. And that is the end of our presentation. So if you have any further questions that we don't get to at the end of this panel, feel free to send us an email. Thank you.
Great, thank you very much. Each of you gave really great presentations about community policing. And now we have a couple questions. So the first is for the first presenter. You said community policing is becoming a crime reduction strategy. Do you believe there is a criminological theory that explains why this program is expected to work theoretically?
Okay. Oh, sorry. There we go. So I actually I did address this in my paper, and because there was a paper done on it in 2010. It was a Michael Reisig article, talked about how the theoretical backing for community policing generally kind of stems from, and it's usually implied, it's never really openly stated, but both broken windows and social disorganization. And that's, either from community policing working to address disorder and kind of building relationships through that, and then officers kind of being on the ground through foot patrol and, kind of building relationships through improving quality of life. And also with social disorganization, the idea is that they are, building informal social control, so community members have the ability to kind of help prevent crime themselves and kind of build that collective efficacy needed to prevent it without needing police.
Great. This is also for you, Alex. For the first presentation, is it better to understand community policing as a set of characteristics that departments have, or could it be that community policing is just as community policing does?
So I definitely think that it should be kind of considered more of a set of characteristics. In this, it's not bad to have this overarching idea, obviously, of community policing, because that is what it is. But I do think, if it's something that is kind of touted as this huge, this way to really change and a way to address these major issues, especially, in these times with everything that's been going on, it is useful to really know exactly what works, so before we allocate funds to it and then say that this is the way to address it. So looking at it as a set of characteristics, I think is pretty useful, because in the way that Daniel did, in their presentation and their research, looking at it like the set of Lemus characteristics, and it was kind of a, the more implementation of it that was gathered, it was kind of like a, larger set of community policing characteristics, which I think is kind of useful to look at it like that.
Great. Do you think a telehealth type program could work inside the jail? If so, how?
Okay, I assume this one is for me. Yeah, telehealth is used. I guess I'm thinking more televisitation is definitely used in jails as a way of connecting people to loved ones. One of the issues has been not fully replacing visitation with only having a tele option, even though it is more cost effective. But yes, telehealth could be used in a similar way, especially given in places like Harris County, there is far more inmates with mental health issues than they have for capacity for in their mental health units. So even though mental health units in a jail are equipped to house individuals and have staff, right, accessible for individuals with mental health, there are, individuals with mental health issues all over the jail. And so, yeah, I definitely think telehealth could be applied to a jail setting to more quickly kind of access individuals rather than kind of waiting to be able to get into kind of the medical unit to be able to see someone. So yeah, I could see that application. I don't know much about that research wise, but I could definitely see that application.
Great. For the last presenters, did any of the community members report positive feedback for the policing program? I know there was a quote in the presentation, but what were some of the positives that were reported?
Do you want me to take this or do you want to, Libby? Okay. Yeah, we definitely saw a mix. And like Libby mentioned, how there was a lot of variation between the different developments. There was one development where there was a lot of positive feedback, and there were, across some other developments, there's a big mix, and there's one development where there was a lot of negative feedback. Since we didn't have time to go over the details of like all of the responses, we just thought we'd highlight some of the most compelling, important information. And I personally think that even if you have a lot of positive feedback, like having any resident say that an officer was behaving in a racist manner is just super important to highlight in impact evaluation.
Okay. Ms. Robin or Doyle, residents didn't attribute lowered crime to CSP. Did you see changes in arrest of service call rates outside of CSP zones suggesting outside factors driving the rate changes?
I could take that because it's a quick answer. We actually, for this particular assessment, didn't look at the area around the developments. It's just rather difficult because of the way that LAPD will ping, like they're able to partition all of their arrest, crime, and calls for service data for the developments, but it would involve a lot more geospatial analysis to identify like a border around the developments. So we actually didn't assess that for this, but it's definitely an interesting question that we would love to look at.
Great. Why do you think there was such a variety of responses between developments?
I can take this one, Lily, but feel free to add on if I miss anything. I think one of the biggest issues was, that they used the same kind of format for the CSP program across pretty different sites. And so what we saw was in some of the larger sites, we saw lowered reports of engagement with the CSP. So the larger developments had the same number of officers as the smaller ones. So I think that was one reason that we got such varied responses. And then I think it also kind of boiled down to the individual officers that were working in these developments, whether they were really sticking to the mission of the program and had really bought into it and were kind of reflecting the different values and putting in that effort to really engage and build relationships with the community members.
Yep. The only two things I would add are one thing that we had heard from officers in the program is, and maybe some managers, HACLA managers too, is just that there's different levels of engagement in these, there's resident advisory groups that are also involved in these programs, and just different developments have different levels of engagement for those resident advisory groups. And I think that makes a huge impact with like buy-in and community interest. And then Libby was kind of touching on this with the officers, but they have a lot of, so it's the same model, but officers have a lot of discretion in terms of what programming they run. So like you could have an officer that is like really interesting in surfing and takes kids to the beach and surfing, and that's probably a super cool program and kids love it. And then in another development, you might just not have that program because it is driven by that officer's personal interest in it.
Great. Well, we are going to wrap up this panel. If anybody has any other questions for panelists, you can reach out to them personally through email. Thank you all for coming. They were great presentations. And if you'd like to join for the next session, you'll have to rejoin this Zoom session. But I hope you all have a great day.
Thank you.
Thank you.
Thanks.